afternoon. Hi, my name is Robin.
I'm Dale.
Nice to meet you, Dale. May I call you Dale?
Yes.
All right, thank you. I'm here to perform an exam, but before we get started, I'm going to wash my hands. And the exam will entail your skin, your heart, your lungs, and your abdomen. Is that okay? Do you have any concerns before we get started?
Let's get
About 10 minutes. 15, I'm going to try to go ahead and go as fast and be as thorough as I can.
Okay.
I have 3 questions. The first 2 are, may I see your armband? Could you tell me your name and your date of birth?
Dale Humby, 7/7/1970.
Thank you. And do you know where you're located?
Nashville, Tennessee.
All right. The client is awake, alert, and oriented ×3. So I'm going to check your skin on your arms first. Is that okay? So I'm checking the anterior and posterior of Miss Dale's arms, making sure I see no lesions, no cyanosis, no pallor, no jaundice. Her skin color is uniform. I'm going to check your radial pulses. Radial pulses are equal and brisk and 2+. Could you squeeze my fingers as tight as you can? Hand grips are 5+. And then I'm going to check for your capillary refill. Capillary refill is less than 3 seconds. And then I'm going to check your skin turner and make sure that you're not dehydrated and your skin is brisk. Your temperature on your arms. Your temp is warm, your skin is dry, and there's no moisture. Okay, the next thing I'm going to do is I'm going to check your eyes. And do I have permission to place my hand in the middle of your nose? Okay, can you look, just kind of look straight at me now. So I'm going to bring this light in from the side. I'm going to do it twice, one to each eye, okay? And then the second time. And then if you could just look straight at me. So your pupils are equal, round, reactive to direct light. Concentrally means they close together and open together, and they are accommodating to that light. All right. Next, I'm going to check your ears. All right. So I'm going to pull the pin up. Your eardrum, her tympanic membrane is intact, pearly gray, and light reflective. Light reflex. In your other ear, your tympanic membrane is intact, pearly gray, and light reflex. All right. The next thing I want to do is I would like to check your cheeks, the inside of your mouth, the top of your tongue, the bottom. All right, could you stick out your tongue and say ah? Ah. All right, the cheeks inside looks pink, moist. The ventral part of your tongue, which is the top part, shows no lesions. It's moist. Can you flip your tongue up for the dorsal? And there's no lesions. And pull your bottom lip down, please. Perfect. So you have pink, moist mucous membranes, and there are no lesions detected. Okay. The next thing I want to do is I'm going to ask you, I'm going to work on your chest. Could you take a deep breath in and blow it out for me? Thank you. Your skin is uniform, there's no lesions, and I see no skeletal deformities. And your inspiration, your chest rises and falls symmetrically. All right, the next thing I'm going to do is I'm going to check for your anterior and posterior transverse, make sure that your anterior is less than your chest register that measures across. Okay, so your anterior posterior diameter is less than the transverse diameter symmetrically. And then there's one other thing I'd like to do. If you could take, I'm going to check your check for respiratory excursion. Could you take a deep breath in and blow it out? And it is symmetrical. All right. All right. So this might take just a few minutes. What I'm going to do is I'm going to listen to lung sounds. 10 on the front, 8 to 10 on the front, and 8 to 10 on the back side. Is that okay? Okay. All right. So if you wouldn't mind, take a deep breath in and blow it out every time I move my stethoscope. Start with the clavicle. I won't move around this much. right. Your breath sounds are clear and present. The predominant lung sound is resonance, which means that's normal or there are no abnormalities to it. And there is an absence of, or there is, I heard no wheezes, no riles, and no rhonchi. So everything in your chest so far sounds good.
Oh.
All right. The next thing we're going to do is I'm going to listen to your heart. So if you wouldn't mind laying down for me, and I'm going to raise the head of the bed up about 30 degrees. And I'll cover you up and raise your shoulder. Okay. So what I'm going to do is I'm going to ask you to take a deep breath in and blow it out. Okay, great. I see no heaves or no lips. Her skin color is intact, and I see no lesions or skeletal deformities. So what I'm going to do is I'm going to start off in 5 different places, and then I'm going to come back. Okay? All right, the first one I'm listening to is the aortic, which is in the second intercostal space, the right sternal border. Second one is the pulmonic. It's in the second intercostal space, the left sternal border. Third one is herbs, and it is the third intercostal space on the left side of the sternal border. The fourth one is the tricuspid valve. Tricuspid valve is the fourth intercostal space on the left side, left sternal border. And the fifth one is the mitral valve, and that is the left mid-clavicular line. And I'm going to listen to your heart for 1 full minute. Okay. That's 1 minute. I'm going to flip this over. I'm going to come back, starting at the mitral valve, the tricuspid, the herbs, pulmonic, aortic. So your heart rate is 60. Rhythm is equal and normal. You have a normal S1, S2, which is your normal love dub, and then there were no extra heart sounds, so any extra beats or murmurs. Okay. The next thing I'm going to do is take a look at your abdomen, and I'm going to just ask you just to lay still for a minute. I'm going to take a look. Your stomach is flat. Take a deep breath for me. Perfect. It rises and falls. There's symmetry. There are no pulsations and no peristalsis. The skin color is uniform. There's no lesions. Her umbilicus is midline with no discoloration or drainage. And now I'm going to listen to your bowel sounds and make sure starting in the lower right quadrant. Do you mind if I sit? Not back, sorry. Alright. Now I'm going to palpate, just press on your stomach and let me know if there's any tenderness. Okay. I'm starting in the right lower quadrant. Now I'm going to go a little bit deeper. Let me know if there's any tenderness. Okay. There's no guarding, no tenderness, no masses palpated, and organs are all lying in tender positions. And your bowel sounds are normal active, which means they are doing what they're supposed to be doing. They're acting normally.
And I have my tummy grumble.
It was grumbling just a little bit. Okay, so now what we're going to do is I'm going to ask you to stand up for me. Okay? So your spine, if you would look towards that way, I'm checking your paravertebral spine musculature. Does this hurt when I press right here?
No.
Okay. Can you bend over and touch your toes for me? All right. Spine is straight. Is there any tenderness while you're doing that?
No.
There's no lordosis, no kyphosis, or scoliosis. Could you stand straight up for me, please?
Okay.
So now I'm going to ask you to lie back down again,
Okay.
and then I'm going to check your legs,
Okay.
and then we should be, I have one more thing to do after that.
Okay.
So I didn't check your legs earlier, but I'm checking your skin. I'm going to check the anterior and posterior of your legs. I see no lesions, no cyanosis, no pallor, no jaundice, and there's no lesions noted. Her skin color is uniform. I'm going to check for pre-tibial edema for 5 seconds. There's no edema. Checking for her pedal pulses. Her pulses are equal, brisk, and 2+. Checking for capillary refill. Capillary refill for your toes is less than 3 seconds. Can you act like you're mashing the gas or plantar flexion, and that's 5+. And then I'm checking temperature. Temperature of your legs is warm. Your temperature of your legs is warm. Your skin is dry, and there is no moisture. All right, can you sit up on the side of the bed for me? Or the side of the sofa for me, thank you. I'm going to wash my hands, and then I'm going to take your blood pressure on the right arm. Blood pressure is 110 over 80. That concludes your exam. Do you have any questions?
No, I do not.
Thank you for being a wonderful patient.
Thank you.